So at Care Innovations, we like to say that clinicians are people too. I think a lot of people spend time talking about patients and patient engagements and not enough time talking about clinicians and clinician engagement. There was a study that's come out, and it's not shocking to people, that 92% of physicians and nurses hate their EHR. I believe that we can do better than that, and at Care Innovations, we take that challenge quite seriously.
You have these gaps of knowledge in between your visits with patients. As a clinician, I know that with remote patient management, I can manage a larger number of patients, knowing on any given day that the patients that needed my attention got my attention, and I know the other patients were okay.
So the same kind of research and analysis that we do to understand patient engagement, we also bring to clinician engagement. How do we create user experiences for our clinicians that make them feel good about their job on a daily basis? They get them excited to do what they want to do for their patients and for their communities and for their organizations.
For the nurse and also for the physicians, it also provides you with timely, actionable, accurate information. So it used to be, a diabetic was given a paper log and you could see them in the waiting room with their 3 different colors of pens, filling out their log because they're going to go see the doctor. And we'd look at that information and say, this doesn't make any sense, right? Because it wasn't real. So providing that kind of insight to the clinicians really helps, number one, the nurses identify when a patient may need to actually be seen by the doctor, or when the doctor may actually need to do some kind of intervention. And for the physician, they have access to all this information that really helps them to ensure that the patient's on the right medication, they're getting the right tests that they need to be getting. Even for cardiac patients, when is it time to actually, replace that patient's aortic valve? Well, you get all this information, you have this much clearer picture, and you can make, I think, smarter decisions about when interventions become necessary.